Well, this year marks the halfway point in the worldwide campaign to provide children and adults the best information and the greatest access to life-saving vaccines. Our health reporter Carol Pearson takes a look at the progress the medical community has made and what's at stake. Let's have a listen.
2, 3. Good job. Good job.
The goal is to prevent millions of people from getting vaccine-preventable diseases by the year 2020.
Can you take a deep breath?
No.
No? Okay.
The plan is to provide universal access to vaccines to protect people of all ages, from the very young to the very old. The World Health Organization wants people everywhere to know that vaccines work.
First, to say that immunization and vaccines are the most powerful public health tool that we have.
Dr. Flavia Bustreo says 35 years ago, 13 million children lost their lives from diseases that could be prevented by vaccines. That number has been reduced to 6 million, but that's still too many. Today, 85% of children are vaccinated against measles and other deadly diseases, but that number has to get even higher.
We need in a population to have a vaccination coverage that is above 90% in order to have what we call the herd effect.
The herd effect. To tell us what the herd effect actually means and why it's important, I'm joined here in Washington by VOA's health reporter Carol Pearson. It's so good to have you back, Carol. We haven't had you on for several weeks, so I suspect it's because we haven't had any major epidemic that's been making the rounds. So let me ask you about Dr. Bustreo's comments. I mean, she seems to be talking about people as if we're herds of cows or something. Should we be insulted? What is the herd effect?
No. If there are 26 vaccines that protect you against infectious diseases, and so the herd effect that she's talking about are the most. It's a protection against diseases that are the most infectious.
So in other words, the more people who are protected or vaccinated, the safer the herd.
Yes.
Talking about the population.
Right, and you have to have it about 90 to 95% to get protected against some of these diseases, such as measles, for example.
Okay.
Measles, everybody, and I talk to people who don't believe in vaccines, who don't want them for their children, who haven't had their children vaccinated, and what they say is that they are fearful about these vaccines. They're afraid the vaccines can actually give the children diseases. So I talked to a number of other experts besides Dr. Bustreo, and they say the vaccines are now very, very pure, that there is nothing, they even took out preservatives that did not have any negative effect on children, and there is nothing in these vaccines that will ever give a child the disease. Now, what they've done since 1985, polio used to strike about 350,000 children a year, and that's down to something like last year was 37.
Right.
That's a huge drop.
No, it is. And that's a wonderful success rate. But I wonder, Carol, why such a persistent belief among some anti-vaxxers that vaccinations have a direct link to autism? Is there any evidence to point in that direction?
There is no evidence, and studies have been done by the U.S., by the CDC, by health agencies in the United Kingdom, in Italy. You know, there's been numerous studies done, and there is no link. Autism is something that happens within the first couple of months after pregnancy.
So obviously it's an alternative fact. How does an alternative fact like that gain so much traction among celebrities, among so many people that you talk to on the street? There are many parents, as you know, who refuse to have their children vaccinated.
Yes.
Where do they get this evidence from?
Well, there was a doctor, Andrew Wakefield, whose medical license has been revoked. He is British. He now lives in Texas, and he has produced a film called Vaxxed, which is about the harms of vaccinations.
And
he
that
has
sort of led to this groundswell.
Yes, it did, because his study was published in Lancet.
I see.
And which is a British medical.
But that study has since been debunked, correct?
Yes, it has, but the myth has not gone away. So and that's the problem, because if you look for harms of vaccines on the website, or on, you put it in a browser, you will come up with people who say that their child has been harmed by vaccines, because not necessarily autism, but maybe allergies. The other thing is that the children get a lot of vaccinations in the first couple of years of life. And that's when you're going to see autism.
So what would Dr. Bustreo tell a mother who refuses to take her child for vaccinations? What would she tell her?
First of all, you have to respect these people. They want the best for their child. And Dr. Bustreo, who is in charge of maternal, infant, and child health, she's the assistant director at the World Health Organization. She certainly is very passionate about health for children. And so what they would want to do is talk about, what are your fears? Is there something in a vaccine that makes you very concerned? Do you want to space out the vaccines? Most doctors say no, but that it's meant to be given at the time before children can get these diseases, but they are willing to work with parents to allay any fears. That's why thimerosal was taken out, a preservative from vaccines.
I want to ask you about this because I got involved in a bit of an argument with another parent who basically said, I don't even take the flu shot because every time I take the flu shot, I get sick. I mean, again, is that a myth that we're talking about here? Why is that myth so prevalent in what you would think is a modern, scientifically based society?
Right, and it is the science. And I talked to one scientist who said what scientists have to do is get out and talk to people. The myth, I don't know why the flu shot seems to be such a myth, but the CDC, it's interesting, they did a study in the US of the people who died from the flu, and they were in the age bracket of about 24 to 64. So basically, after children had passed through their parents', this was a couple of years ago, their parents' health care to when they could get covered by Medicare, which is for older people.
So Carol, we got 30 seconds. How would you say this campaign has been going? How effective has it been?
The anti-vaccine machine?
World Immunization Week.
World Immunization Week is to get people to talk about immunizations.
Like we are.
And to get people to get their questions answered about whatever questions they happen to have about vaccinations, the safety, the need, and a lot of people don't have all that information.
Carol Pearson, I thank you very much for getting that message across to our viewers. Thank you, Carol, and to all of our correspondents today. That's all the time we have, but I hope you'll join us again next week for another edition of The Correspondents. Meantime, stay up to date with the latest world news. Just go to voanews.com. You can also check out all of our shows there by clicking the Watch tab. We're also on Facebook and YouTube at VOA The Correspondents. I'm Mil Arcega. Thank you for watching, and for now, so long from Washington.